take all of that who luck, take all of that what luck, and take all of those learnings and networks and see if we can drive a lot of creative energy and IQ into solving big problems. So today it's VTE, and Uncle, I don't know what it'll be tomorrow, but I certainly feel empowered to jump in the ring and try to help out.
You're listening to Parallax from Radcliffe Cardiology in association with makeadent.org. Here is your host, Ankur Kalra, MD.
Hello, everyone. Welcome to another episode of Parallax. This is actually a great episode. And, I may be biased, but I've known Shon for several years now. And, one of the reasons I wanted to be a fellow at BI Deaconess Medical Center is Shon, alongside folks like Brian and Yuri and Chris Maduri. I don't know if all of these fine gentlemen are listening, but if you are, as someone who was a resident applying for fellowships and subspecialty fellowships, you were my heroes and you remain my heroes. But let me formally introduce our audience to Shon. Dr. Shon Chakrabarti is the Vice President of Medical Affairs at Inari Medical. But before that, an interventional cardiologist extraordinaire and trained at the Bethesda Deaconess Medical Center, my alma mater, his alma mater. And I could not be more happy to have him as a guest on this show. So without much further ado, Shon, welcome, and thank you so much for doing this for us.
Thank you, Ankur, and far too flattering and undeserved introduction. But likewise, I couldn't be more delighted that we get a chance to catch up, not just as BID alums, but also as friends, as you mentioned. And all these folks, this sort of lineage of people that have trained together, it really is a lifelong bond in a lot of ways. A lot of the names you mentioned, like yourself, are leading very successful careers and making a huge impact on patients in cardiovascular disease. So love making the connection, and thank you so much for the invitation.
Oh, no, my absolute pleasure. So, Shon, I think, so a lot of our audience are fellows in training, early career, or even your early to mid career, or, cardiologists from all subspecialties. And I think your career, to me at least, has been exemplary in how successfully you transitioned from being a busy clinician and an interventional cardiologist to industry. And I think we're going to really, dive deep into that aspect. But why don't you tell us about how it all started for you, right from why you wanted to be a doctor, what inspired you to pursue a career in cardiovascular medicine? How did BI happen? I know you did your training in Michigan, and Ramaji is your mentor, and is someone who inspires me on a daily basis. But why don't we start off from where it all started for you?
Absolutely, Ankur, and I think I've been thinking about doing this podcast and what sort of messages to convey about my career to date, which is still, I think, a young career in a lot of ways. But nonlinearity is something I keep coming back to. That yourself, many other folks that are successful in our field, don't always follow a straight prescribed path, and I think not having fear to veer off the line is really critical. So I'll start at the beginning, but to frame it, I thought I'd bring up a concept that one of my more recent mentors, Seth Bilazarian, who's chief medical officer, formerly chief medical officer at Abiomed, now vice president at Abiomed. He pointed me to a podcast by a gentleman named Jim Collins, who's pretty well known in the business world, maybe less known in the medical world, but he's written a number of books, Built to Last, Good to Great, and he did an episode of The Knowledge Project, which I'm sure you're familiar with as a fellow podcaster, called Keeping the Flywheel in Motion. And he talked about this concept of how, things that create pathways and elevation in our careers are sometimes due to what we consider luck. But it's often not luck at all. It's kind of the opportunities and bedrock that we lay for ourselves manifesting. And the reason I bring him up is he focuses not necessarily on what luck, in quotes, what luck, but rather who luck, in terms of people you come across in your life and in your pathway that give you guidance, that invest in you. And as I go back to the beginning with you here, that concept I hope stands out quite a bit. That I've had tremendous who luck in my career, including meeting you, Encore. And so, going back, I came from an engineering family. My father was a civil engineer. I have one older brother who's a chemical engineer, or studied to be a chemical engineer at the University of Michigan, and then went on to do environmental engineering. And he's currently consulted in California. But that was my roadmap, and I actually studied chemical engineering at Michigan. That was my beginning, and perhaps is part of the reason I'm so interested and continue to be interested in technology. But like many others, my interest was in biomedical engineering and in bringing new technologies to advance medicine. I was going to pursue this as a master's discipline. But early, as a young man, and I'm sure this occurred for you at some point as well, you get this yearning to have maybe a closer human connection, more tangible impact, less far field goals and more short-term goals, things like, hey, I'd love to take care of a heart attack patient and see the look on their face and their family's face when you make a difference. And so I had my first bout of people luck when I just blindly, Ankur, distributed my resume at the University of Michigan Hospital in every department, just to see if I could land a summer gig, and get a closer look at what it would be like to pivot to medicine. And my resume at the time, by the way, was, I was a baker at Einstein's Bagels and I worked at the Fine Arts Library, right? So it wasn't the most robust CV at the time. But only one person got back to me of the maybe 30 CVs that I distributed. And it was a cardiologist. So there you go, right? His name was Sanjay Rajagopalan. He was really interested in vascular medicine and was doing some really innovative things at Michigan with regard to pollution's effects on vascular biology, something he remains an expert in. But he was looking for a young, hungry student who could work in his basic science lab in conjunction with a pathologist. He wanted to correlate vascular reactivity via ultrasound to genetic polymorphisms in the ACE and ENOS genes. I'm kind of impressed. I still remember the project so well. But it was very immersive. So he took me on for a summer and I worked in his lab. I got to practice phlebotomy. I got to assist an ultrasound tech. And most importantly, I had my second bout of who luck by shadowing one of his cardiology fellows named Michael Schmidt, who's currently in practice in Chicago. And Mike was infectious in terms of his enthusiasm for cardiology and patient care. And there were nights, Ankur, where he would call me up and say, Shon, I got a STEMI, you got to come in. And I could just throw on a pair of scrubs as an 18-year-old kid and roll into University of Michigan Hospital and witness firsthand this extremely tangible human connection that physicians get to make. So it was really no looking back for me from there. I pivoted to medical school. I attended Wayne State University in Detroit, and pursued other interest in medicine at that time, thought about surgery, thought about emergency, but came back to cardiology. And then, as you mentioned, landed a residency at the University of Michigan, along with my wife, who I met in medical school. She pursued OBGYN and we both went to Michigan. Wow, what a world-class institution. I'd always been a Michigan fan, grew up in Michigan. So, you pick one or the other, Michigan or state. And I was one of the maize and blue folks for sure. And as you mentioned, I had a chance to connect with Kim Eagle, Branji Nelamathu, and really learned a lot about the world of clinical research beyond the bench and getting more towards clinical outcomes, and did some really phenomenal, exciting work looking at national registries and metrics related to door-to-balloon times and STEMI. This was, you know, in the early 2000s. So when we were still optimizing a lot of our strategies around STEMI care. And, you know, you can imagine what it was like to work with those individuals. So another round perhaps of Hulak there, Encore. And then I can keep going. I was able to obviously make it over to the BI Deaconess along with yourself. And geez, I mean, the things that were being done there at the time. I mean, I think back to the leaders at the BI during the time of my fellowship when you were in residency, and we're talking about people like Michael Gibson, who was a research mentor for me, and truly someone who invested in me and gave me a ton of guidance. Dwayne Pinto was my fellowship director. Jeff Popma was doing early TAVR studies and early TAVR work at the BI at that time. Don Cutlip was running the lab in the Harvard Clinical Research Institute. It was just a really incredible place to be. And again, consider myself so lucky to work with that group. And you know Mike well. Mike's been on your podcast. And who's more prolific and productive than Dr. Michael Gibson, right? So the opportunities he opened up to a fellow that was willing to dive in headfirst with him is what really propelled my career in the direction that I believe it's taken now. You know, one that's very focused on clinical research and outcomes and transforming disease states and thinking big. You know, thinking big and thinking about large enterprises beyond the patients that you can see in clinic on a day-to-day basis. So I hope that frames sort of well that phase of the career, and I'd be happy to chat a bit about the industry transition, but wanted to make sure that I sort of answered your question and that really career phase.
No, you absolutely did. And, as you were describing your beautiful journey, I was listening in awe and smiling. And, I was sort of counting my blessings because so many of the names that you mentioned are the names that I happen to work with, and it's sort of, my who luck. So I was counting on my who luck, and I was, remembering the times that I've spent with them, and, in folks like, Dr. Gibson, who I couldn't agree more, haven't seen an individual who's, as prolific as Dr. Gibson is, when it comes to designing, multi-center, just worldwide trials and publishing in the New England Journal or, some of the similar high impact journals, and really has had an impact, when it comes to how we look at patients with TIMI score, how we do myocardial blush grade, how we manage antithrombotic anticoagulant therapy. I mean, so many of these steps and decision making pivots that we consider for granted in modern medicine are some of the works that he's done, and so sort of to be to have trained with him and know him in person is incredible, right? And then extrapolate the same to Jeff Popma, who now is at Medtronic, but was at the BI at the time when we both were there. He was my program director. He took over the helm from Don Cutlip, who recruited me to BI. But again, just incredible individuals, to have worked with and trained with. And then Brahmaji, continues to inspire so many. Remains at Michigan and is at the helm for CircCQO. So he definitely has an indelible impact on outcomes research in cardiovascular medicine. So again, it's who luck, and I couldn't agree more with you. It's a blessing, and as you were taking these names one after the other, I was just smiling and counting my own who luck. So thank you for taking me down that memory lane. But moving along, when in your career, and maybe this transition came to you more naturally because you have an engineering background, and it's sort of always inspiring to see people with different backgrounds in medicine. Like yourself. I mean, you have the other person who has a similar background like yours is Farzad. Azimpur, who's now with Edwards Life Sciences and is someone who I would like to get on the podcast. He knows about that. But, um, when was it in your career as an interventionalist that you decided, okay, if an opportunity presents itself, I'm going to explore that more given my background in engineering?
Yeah, it's a fabulous question. It's one I get often, Ankur. I mean, you'd be surprised, or maybe you probably wouldn't be surprised at how often I get a reach out from young interventionalists or not even mid-career interventionalists that are strongly considering industry, but have this sort of um, fear of loss of identity, or even more so, sort of a sunk cost fallacy, where they feel, geez, I've put in all this postgraduate training time. Am I just going to hang up the white coat? And I was definitely one of those people. I mean, I didn't leave fellowship with any plans to make an industry transition, within the first 10 years of my postgraduate career. That was definitely not in the game plan for me. Um, but use the word opportunity, and that's exactly how it presented to me. So, after the BI, I took a practice position in Southern Virginia at the Sentara System in Norfolk Hospital. Again, people are the primary influence, and there was a physician named Ron McKechnie who was a Michigan trainee as well, who was in practice there and thriving. Um, and so I joined them and had just a lovely um, uh, career path there. Both in terms of the clinical need in that area. I mean, so much coronary disease, um, as well as helping to build systems there around STEMI, something that I, again, was able to work on from a research capacity, but now able to implement along with other great partners in the Virginia Heart Attack Coalition on the ground level. And also dove into a lot of advocacy work when I was there. I started working with the American Heart Association and took a board position locally, and a lot of great work there in terms of advocacy at the local level. Um, but I never really let go of my connection with Dr. Gibson. Was continuing to work on clinical trials remotely, and he, as you know, went on to take over HCRI and what is now the Paved Institute. So really continues to be at the forefront of that interface between academic medicine and industry and new technology. Um, Dr. Gibson, I failed to mention that during fellowship, talk about investment and guidance. He funded and supported my master's in public health at the time to really dive deep on clinical effectiveness and learn what it was to run large clinical trials. And these are all skill sets that you acquire, right, Ankur? But you don't know how they're going to manifest in the future. So here I am, about 4.5 years into a practice, making a life for myself in Southern Virginia, in a lovely community. I have 3 small daughters at this point, and an opportunity presents itself, an unexpected opportunity, where I mentioned before, Seth Bilazarian reached out regarding a position at a company that I was already quite fond of, Abumed, which is based in the Boston area, greater Boston area, an area that's familiar to both of us, obviously. And they were looking for someone to help lead a disruptive, um, practice-changing randomized clinical trial, which you're familiar with, called STEMI DTU, being led by Dr. Naveen Kapoor at Tufts Medical. So here's the next round of people luck, right? Seth and Naveen come into my life and completely disrupt my game plan and present an opportunity for me to come on at an elevated position as medical director for a really innovative medical device company, and also dive completely headfirst into the world that I felt like I was preparing for with Dr. Gibson, which is large scale device clinical trials that are practice changing. Um, so I had some big decisions to make earlier than I thought, in terms of leaving bedside medicine as my primary job and identity to working in medical technology and industry, completely changing my day-to-day interface and giving up a lot of what you and I love about medicine, which is being at the bedside with the patient, in order to perhaps reach a larger group, make a bigger imprint than potentially I can make from day to day in clinic. And in this case, that would be, maybe revolutionizing the way that we treat heart attacks and helping people live longer and with a better quality of life through a really innovative clinical protocol. So it wasn't a decision that came easily, Encore, and it takes it takes a good deal of reflection, personally and professionally, to say, hey, look, this opportunity is here. I could pass on it and still continue a great career trajectory otherwise, or go for it, right? And that decision revolved around a lot of reach outs to people I know and trust. Some of the people we've already talked about, I definitely called Mike to get his take on things. I spoke to other interventionalists, Encore, that have made industry transitions, people like Craig Thompson, who went to Boston Scientific for a number of years before eventually actually coming back and running the cath lab at NYU, Dave Kanzari, and someone that I think we'll talk a bit more about, who's also been on your podcast, but Chuck Simonton. And when you talk to these folks, it becomes very apparent that there's no identity loss here. You're still a cardiologist, you're still serving cardiovascular patients and advancing cardiovascular disease, but it's through a vehicle of innovation, and one that I think many of us are equipped to jump into and really elevate. So I owe it to Seth and I owe it to Abiomed to have introduced me to this world a lot earlier than I ever anticipated, jumping into it. And yeah, as you mentioned, engineering background, public health background, all of these things probably informed not only the reach out from their side, but also ultimately my decision to jump in head first. So that's how I found myself, in my late 30s, taking an industry position.
Yeah, no, yeah, so incredible. Yeah, really, what a beautiful story. And you were mentioning the pieces, on engineering and public health, and I was thinking, just through my spiritual practice and my spiritual background, that someone else up there was writing the story of Shon Chakrabarti, right? I'm going to introduce him to engineering. I'm going to introduce him to an opportunity in clinical effectiveness and public health at Harvard School of Public Health. He's going to practice interventional cardiology and take care of patients at the bedside and know what it's like to be a physician taking care of such patients in acuity and at one of their most vulnerable times in their lifetimes. And then that's such a perfect concoction for someone like you to be in a position where you are right now in life, right? Like I probably could count on fingertips people with a background similar to yours. Like, who would have a background in engineering, public health, and medicine and interventional cardiology. So, congratulations to you, and for both, having such a successful career path, but more importantly, for having the ability to, first off, keep improving your skill sets and keep, imbibing more skill sets, more diversified skill sets. That's one, but also, seeing the opportunity the way you saw it, and making those decisions, and moving forward into uncharted territories where people from the more conventional background be like, I'm not sure if this is for me, and I became a doctor for a reason, that was to take care of patients. But like you said, with an opportunity to design clinical trials which move medicine forward, which advance the care of patients, and which can transform not only the care for patients that you touch, through your own hands, but through the work that you've done through industry or through clinical investigation, you can now essentially transform the care for millions of patients across the globe. And that is such an incredible opportunity if you think about it that way. That, I was part of this innovation that now has transformed the care for millions across the globe. And, people like yourself, can say that. And, that really motivates me, the magnitude, like you said, the magnitude of your imprint, is very inspirational for me, as I think about my career and what I want to do in life also. But no, thanks for sharing your journey with us and your story with us. Let me ask you a couple follow-up questions, because I was thinking about these as we were as you were describing your journey. And one of the questions is, in this transition, what has been the part that you feel you've lost? And maybe the answer to that is, Ankur, I don't think I've lost anything, and that's great. But what is the one part you think you may have lost? And the second part to this question is, what do you think has been the most empowering? So if you can answer those questions for me.
Absolutely, and great questions. So, with any big decision, I think there are sacrifices you make. I mentioned earlier in my story that one of the reasons I pivoted from engineering to medicine in the first place was, to get away from more far field goals, albeit very big impact goals, right? To get a closer human connection, to get a more tangible impact. And I tell people now, who ask me about making the transition and working in industry, that there are highs from what you do from day to day, from what our colleagues do from day to day, that I don't achieve on a day to day basis anymore. There's no equivalent in my current world, Ankur, of going into the hospital at 2 a.m. In an emergency setting with a patient descending into cardiogenic shock from a large LED occlusion and performing a simple, elegant, beautiful procedure that leaves the patient essentially with no pain, no discomfort, and a healing heart within minutes. And then walking out of the cath lab suite and telling that family that, they saved their family member's life by bringing them to the hospital, by calling 911, and a culmination of efforts from a number of people, right, has resulted in this small miracle occurring and leading to decades of impact on people's lives. There's no replacement for that for me now, right? I might crush a Zoom meeting, or I might, have a really great outcome from a research call, but that's not something I'm experiencing on a day-to-day basis. Now, as I've gotten a little older and got a few more gray hairs, those far field goals are more apparent to me and valuable to me. And you mentioned the impact of work. And, as I was listening to that, all I could help think was, geez, I'm a speck. I'm a small participant in a much larger cog and a much larger machine that brings new technologies that create more miracles, right? More miracles like the STEMI patient I just described. Um, but if you were to ask me what I've lost, that's at the forefront of my mind, and I think physicians can relate to that. And I think for anyone making a decision to evolve their career or move in new directions, scary directions, that an upfront catalog of what you're losing is a very nice, honest exercise to take. Um, so you asked me what was most empowering as well, and continuing my story, as you know, I've more recently linked back up with a fellow BI colleague, Dr. Tom Tu, who I hope you've met. He's a brilliant operator, but also a brilliant innovator. And after spending some time with Dr. Chuck Simonton, who's now the CMO at Abiomed, and learning about his career path and the various ways you can affect our field through research, through regulatory relationships, through innovation, I became aware of some of the things happening at Inari Medical, which is where I am now. And what's been empowering for me is feeling like now, a few years in to this world, I can move to perhaps an earlier stage place where there is more of a free form, disruptive attitude and approach towards big medical problems. And Inari is a place where they're diving deep into a disease state of venous thromboembolism, as you know. something that cardiologists are starting to get very interested in, right? And this is a place where people are thinking big, but it's in many ways a nascent state. Venous thromboembolism's another frontier, in cardiovascular medicine. We've seen previous frontiers with MI, which you and I talked about earlier on this podcast, and stroke, where previous treatment modalities have been bed rest and anticoagulants or bed rest and lytics. And we've seen those disease states revolutionized by technology and skill and training, creating systems, diagnoses, getting the right physicians and skill sets in front of these patients to perform catheter-based procedures in both cases, to really improve outcomes beyond what they've been before. And VTE, and specifically maybe pulmonary embolism, is very much at that precipice. And so Tom, the CEO at Inari, Bill Hoffman, had this big vision, to take a relatively elegant but simple technology, and revolutionize a disease state. And so here I am, feeling empowered, to use your word, to jump in this with them and take all of that who luck, take all of that what luck, and take all of those learnings and networks, and see if we can drive a lot of creative energy and IQ into solving big problems. So today it's VTE, and Uncle, I don't know what it'll be tomorrow, but I certainly feel empowered to jump in the ring and try to help out.
Yeah, no, this is excellent, and I couldn't agree with you more. Venous thromboembolism is a menace, and particularly with the advent of the pandemic and COVID-19, and we know as cardiologists that venous thromboembolism is one of the many manifestations of COVID-19 infection. It has taken lives prematurely, and is something which sort of has been not at the forefront because we had big problems like MI care that we needed to grapple with. But now that we're optimizing ourselves with MI care, the big frontiers are, like you mentioned, venous thromboembolism and cardiogenic shock. And there's a lot of work that needs to be done, in both these fields in order to, progress care and, save more lives and impact lives of millions of patients around the globe. So congratulations to you on your work and your forthcoming work. And I really hope and pray that the creative energies and the networks and the connections that you've been able to, build and foster for all these years come to fruition in coming up with a solution for venous thromboembolism. That'll be fantastic. And I think, hopefully universe has put you at the right place at the right time for you to be able to move forward with this. So congratulations again on this. Few last few minutes on the podcast. And I've really thoroughly enjoyed this conversation. It's been phenomenal to listen to your journey and what you've been able to accomplish thus far. What is the one advice you would have for, or maybe more than one advice you would have for fellows in training, particularly interventional fellows in training, because that is obviously close to both of us. And what is the other? So an extension to this question is there anything you would say to the younger Shon who was distributing his resumes to physicians at University of Michigan? So those two questions.
Oh, absolutely. So, in terms of advice, I've been, again, thinking about this ahead of and anticipating our podcast today. And, geez, this is advice not that is generated from me, but rather from all of those mentors and people you accumulate over life that pass wisdom to you. But one is think big. And even, geez, I mentioned Bill Hoffman, the CEO at Inari Medical. He just said this to me last week, and it was, again, a wake-up call. Like, why aren't we thinking bigger? And I think as it pertains to younger folks in training, or maybe even my younger self, I'd interpret that also to not limiting the scope of your career to just what your perhaps senior partners or predecessors have done, right? The world's evolving rapidly, and um, there's no reason to ever put limits on what you see your career being in the future. Second is, and this is more pertinent to fellows than maybe my younger self, but remember that you're always a physician. That can't be taken away from you. And as long as you've dedicated your life to the service of your patients, you can achieve in many different ways. So don't fear the loss of identity, no matter what path you take. And then I'd like to come back to the very beginning of our discussion today, which I've also thoroughly enjoyed, by the way, Encore. Thank you so much. Which is maximize your HULOC. And how do you do this? You do this by investing your time and your energy in people that'll teach you and elevate you. And I can't emphasize that point enough. I'm calling it luck. We both know it's really not, right? It's really a dedicated effort to forge those relationships and accumulate mentors. So if there's something to really put your time and energy into, I would take stock of that. And then lastly, and this is definitely one that I would tell my younger self, that at times I think I followed, but at times maybe I didn't, which is when an opportunity presents itself, at times you need to proceed fearlessly and be bold. And that's going to mean there's failures. But ultimately is what can lead to great success. So those would be sort of my short catalog of learnings that I would pass on to your audience, and to younger folks in training, and those continue to serve me well, and I use those concepts honestly on a daily basis, especially now.
Yeah, no, great message. And I just, want to bolster or reiterate what you said. Well, first off, I think, and I couldn't agree with you more. It's more than just luck, right? It's what you make of it. That's what I always tell myself. Because people will be like, okay, you've been to X, Y, and Z places. But, we know a lot of people go to X, Y, and Z places, and there are only a select few who keep elevating themselves, time and again. And those are the people who really make something out of the opportunities that life presented them, right? So, so if we were to take your career, for example, it's, how you fostered those relationships with Seth, or with Dr. Gibson, or with Jeff, or with Dr. Cutlip. It's an effort. It's not flattery. It's a genuine effort to get to know that person more. It's a genuine effort to carve out time to work more with these people who, you think you've established a connection with and identify yourself with, or the kinds of things you want to do in your life. So it's more than just luck. I think it's what you make of it, like you said. And then the second thing you mentioned, which resonates with me personally, and so I think it's important to sort of stress it on the podcast, and I think of it in a little different way. And you mentioned about being fearless and being bold, and being mindful that there may be failures. I sort of think of it as like success is moving from one failure to the other with the same enthusiasm. So, if you haven't really lost your enthusiasm, you are going to meet with challenges which some may define as failures, but really those are just stepping stones for the bigger picture, so that's sort of the far field vision of what you want to accomplish. And as long as that is clear and right and center, then, everything else will just become a stepping stone or a challenge. That, at least that's how I like to think of it. And that's something that sort of that thought process has, sort of kept me going through the various challenges that I have faced, in my career thus far. But, no, this has been amazing. This has been a trip down the memory lane for me personally, also, Shon. So thank you for bringing all those beautiful memories of BI up. again. I vividly remember the hallways, the cath labs, the Baker conference room, where sort of I've personally had a chance to interact with you, the fellows, the cath fellows call room, the room where we did our reports, what have you. It's just been, and those are such beautiful memories for me personally, that whenever I think of it, I smile. I have a smile on my face, and that's something which just comes to me naturally. Any closing remarks for the podcast, Shon?
Just a word of thanks to you. I think, what you're doing here to bring voices throughout our field, from academic to innovation to teachers, I think is just so tremendous, Ankur. And I've obviously been following your career closely. I think you've taken a page from the Mike Gibson book in terms of integrating art and disciplines outside of just pure medicine to really enrich your career and enrich your message. So just a big thank you to you for the opportunity. And, my closing thought would be going back to the concept we just crystallized in your comments, which is to proceed fearlessly and be bold and get the best return on your luck that you possibly can. So thanks again.
No, thanks, Shon. Talk to you soon.
We hope you enjoyed today's podcast, produced by Radcliffe Cardiology in association with makeadent.org. We aim to bring you a new angle of all things cardiology every second week. Review us on your favourite podcast app, or send your comments or questions to podcast@radcliffe-group.com. To view the series, head to radcliffecardiology.com/podcasts/Parallax. Thanks for listening.